I am Dr. Satya Balasubramaniam. I am a fertility specialist in Sundaram Medical Foundation. There are three levels of fertility treatment. Level 1 is a very basic treatment, and that is called ovulation induction. In a woman who has irregular cycles, which means that she is not releasing an egg every month, we can give certain tablets to help her to ovulate. These include Clomiphene and Letrozole. A good number of women will ovulate on these drugs, and about 40% would conceive with these tablets alone. In case a woman is not able to ovulate with the tablets, or she is not conceiving in spite of ovulation, we go to the next level of treatment, which is called super ovulation. So along with the tablets, we add injections called gonadotrophins, which help us to produce 2 or 3 eggs instead of the 1 egg that she anyway produces. And then she has ultrasound scan to see how her follicles are growing. Once the follicles or egg containing sacs reach about 18 millimeters in size, we give an injection to release the egg, and once the egg is released, we ask the couple to have intercourse. This is called super ovulation plus timed intercourse. We can try up to 2 to 3 cycles of this treatment. If a woman does not conceive with this treatment also, we go to the next level treatment. This is called IUI. IUI stands for intrauterine insemination. Here we inject the best quality sperms from the semen sample into the uterus of the woman on the day that she is releasing the egg. So for this, as an initial preparation, we do the super ovulation with tablets and injections. The woman comes for scans 2 or 3 times to see how the egg is growing, and the day she is releasing the egg, the husband provides a semen sample of which we take out the most motile sperms, and 0.5 ml of that processed semen sample is injected into the uterus. The probability of conceiving in an IUI cycle is between 10 to 15%. We can try up to 4 cycles of IUI. If IUI is also unsuccessful, then we go to the third level and the most final level of treatment called as IVF. IVF has got 4 steps. Step 1 is to produce a large number of eggs, something like 15 to 20 eggs, by giving multiple injections to the female partner starting day 2. After 10 days of injections, once the follicles become 18 millimeters in size, we give her a trigger injection, and 36 hours after the trigger injections, we go for the egg collection. The egg collection is a process done under anesthesia. It is done transvaginally, and post egg collection, we hand over the eggs to our scientists. They are called embryologists. The embryologist will inject the husband's sperm into the wife's eggs under a microscope, and after that leave them into an incubator. About 6 days later, some of these eggs would have become embryos, and the good ones will be frozen. In the following cycle, we prepare the uterus with certain tablets, and once the uterus is ready, we'll transfer 1 or 2 embryos back into the uterus. The chance of conceiving in this kind of treatment is around 40% per attempt. So if we create 6 embryos and we transfer 2 at a time, by the time 3 rounds of embryo transfers are done, there's an 80% chance that the woman would conceive. So this is the highest available fertility treatment. The complications of this treatment include multiple pregnancy and a condition called ovarian hyperstimulation syndrome. Fortunately, ovarian hyperstimulation syndrome is very rare, seen in less than 1% cases. However, twin pregnancies are a little more common. About 25 out of 100 IVF pregnancies are twin pregnancies.